Hey guys, in the previous video we had talked about the lid speculum forceps, hooks and retractor, and the needle holders, also the knives. And in this video we are going to study the remaining ophthalmic instruments. So let's begin with the first one, and that is plain straight scissor. It is a fine pointed scissor with straight sharp cutting blades, and it is used to cut conjunctival sutures, eyelashes, and the muscles. It is simple. Okay, next is a plain curved scissor. So you can see here the curve is, and it's a plain scissor with curved sharp cutting blades, and it is used to cut and undermine conjunctiva and skin in various operations. What is this? It is a corneal scissor or section enlarging scissor. Their cutting blades are kept apart by spring action, right? And they are used to enlarge the corneal or sclerocorneal incision in cataract surgery. What about this? It is known as De Wecker's scissor. They are fine scissors with small blades directed at right angle to the arms, right? You can see here. And it is used to perform iridectomy for cutting a prolapsed form vitreous. Let's move toward this one. It is a spring scissor, also known as Westcott's, and used for cutting and undermining conjunctiva in various operations and cut sutures. It is known as Venus scissor. It is a fine, delicate pair of scissors with sharp edges, and it is used to cut vitreous during a prolapse vitreous. Now, we are starting the calipers. So the first one is Castroviejo caliper. It is a divider-like instrument to one arm of which is attached a graduated scale. You can see here. Its other arm can be moved by a screw over the scale, and it is used to take measurement during squint, ptosis, retinal detachment, and pars plana vitrectomy surgery. Let's move toward the clamps, and the clamps include the first one, chalazion clamp. It consists of two limbs like forceps, which can be clamped with the help of screw, used to fix chalazion and achieve hemostasis during incision and drainage. What about this? It is known as ptosis clamp. It consists of a D-shaped plate opposed by U-shaped rim, which can be tightened by the help of screw, clamp the tissue. The plate is toward the conjunctival side, so it protects the eye during lid surgery on the skin side. The screw faces the outer side, and the handle is always situated on the temporal side. What about this? It is known as entropion clamp. It has a plate which is placed under the eyelid, curved hook, right? You can see the plate, and it has curved hook which will be on the outer side of the lid, and screw to tight the lid. Screw and the curved hook. It is used for entropion surgery to hold the eyelid and create the hemostasis. Let's talk about the additional instrument for cataract surgery and intraocular lens implantation. And the first among them is blade breaker. It has a handle and two blades to fix the part of blade. It is used to fix the part of atom blade, which is used during cataract for corneal incision. This is wire rectus. It is circular oval structure attached to a metallic handle and used to remove the dislocated or subluxated lens and nucleus. Two-way irrigation and aspiration cannula. It is available in various designs, commonly used as Simcoe, classical, or reserve cannula, right? And it is used for irrigation and suction of lens matter in extracapsular cataract extraction. Aspiration of hypomine is also done through it. Let's talk about the iris depositor. It is delicate, flat, metallic, straight, or bent blade with blunt edges and tip attached to a handle to deposit the iris in the anterior chamber in any intraocular surgery. So we are moving toward the additional instrument for intraocular lens implantation, and the first one among them is what? Kellman-McPherson forceps, intraocular lens holding forceps. Also it is known as this. This is a fine forceps with blunt limb to hold the haptics of intraocular lens during its placement. What about this? It is Sinskey hook or intraocular lens dialer. It is a fine instrument with a bent tip which engages the dialing hole of the intraocular lens to dial the intraocular lens for proper positioning in the capsular bag. This is known as hydrodissection cannula. It is single bore 25 gauge, 27 gauge, or 30 gauge cannula with 45-degree angulation at about 10 to 12 mm from the free end. It is used to perform hydrodissection, which is separation of posterior capsule from the cortex, and also hydrodelineation, which is separation of the cortex from the nucleus in phacoemulsification. Let's talk about the chopper. It is a fine instrument resembling a hook in shape. The inner edge of the bent tip is used as the cutting edge. It is used to split or chop the nucleus into smaller pieces. Let's talk about the instrument for lead surgery. And the first is chalazion scoop. It is a small cup with sharp margin attached to the narrow blade and used to scoop out the content of chalazion during incision and curettage. Instrument for lacrimal sac surgery. The first one is using punctum dilator. It is cylindrical corrugated metal handle with conical pointed tip and used to dilate the punctum in canalicculus during syringing, probing, and DCR operation. It is lacrimal probes, also known as Bowman's probes. These are a set of straight metal wires of varying thickness with blunt, rounded end and flattened central part, used to probe nasolacrimal duct in congenital blockage and DCR operation. A lacrimal cannula. It is a link curved hypodermic needle with blunt tip for syringing the lacrimal passage. Bone punch. It has spring handle with 2 blades to enlarge the bony opening during DCR operation. Dacrocystorhinostomy burr. It has handle at one end, serrated burr at the other end. Handle and serrated burr. It is used to create a hole in a lateral wall of the nose. It is a bone nibbler. It is used to break the bone and enlarge the hole created by DCR burr. Instrument for enucleation and evisceration. So the first one is this. It is known as evisceration spatula. It consists of small rectangular blade with slight convex surface and blunt edges attached to the handle. It is used to separate the uveal tissue in evisceration operation. What about the next one, which is very common, and I'm sure you know this, and it is direct ophthalmoscope. It is used to distend direct ophthalmoscopy in fundus examination. And last but not the least, it is a plantation tonometer and used to measure the intraocular pressure. Thank you so much for watching. Subscribe for more.